When you think about the words palliative care, what comes to mind? Maybe the nurse holding the hand of a dying patient in a hospital bed. I was the same way. I used to use words like left us or passed away. And one day, one of the doctors that I work with came up to me and said, Trina, you know, you're gonna need to get used to the 3 Ds: death, dying, and dead. Kind of shocking. So outwardly, I think I was composed, but inwardly, I definitely looked a lot like this. Now, I'm pretty sure he had me pegged, but I was thinking to myself, what kind of job did I get myself into here? What I can tell you is that palliative care is about living. It is not about dying, although dying is part of the process. Palliative care is about spending the time on the things that are most important to you. It is about relieving suffering from pain, not just physical, but social, spiritual, and psychological. As Lisa mentioned, we are all going to die. It's not if, it's when. And when that time draws near for all of us, a palliative approach to our care will make sure that we're spending it in the ways that we want to spend it. When I talk about this type of work, almost instantly people tell me stories about themselves or their loved ones, and they often recall painful memories and situations. So if you would, take a moment and bring that memory forward with me as we walk towards a new way of providing palliative care. 80% of us say we want to be at home at the end of life, but only around 20% are making it there. As a technologist and a part-time researcher, this statistic is very shocking to me. It doesn't make any sense. How can we have the exact opposite of what we say we want happening? I'm going to give you 3 scenarios, and you may have experienced one of these in your own life, that can lead to that just 20% getting home and staying home. Scenario number 1. The patient is in the hospital setting, and they say, I want to go home. But the family is really nervous to take them home. And so the family advocates strongly with the patient and with the healthcare team, and the patient agrees, and they stay with us in hospital. Scenario 2. The patient says that they want to go home, and they do go home. So the system looks like it's working. There's a plan. They're going to be at home and peaceful in their own environment. The problem is that the family can only access the healthcare team by traditional means. And so, in the middle of the night, something changes with the patient. Maybe a symptom gets worse. And the family doesn't know what to do, so they call 911. But now, not only does the ambulance show up, but also the fire department and the police department as first responders. The patient is taken to the emergency room, where they may or may not undergo tests and treatments, and they may die there in the emergency room, or again in the hospital setting. Scenario 3. As patients get sicker, doctors and nurse practitioners need to see them more often. And so we ask them to come into the clinic more, to travel more, and to spend more time in waiting rooms. You can imagine the appointment fatigue for that patient and family. They're not able to spend the time on what's most important to them. I think you'd agree it's a heavy burden to place on those patients and families. When you stand back and look across these complicated situations and try and figure out what could possibly help fix them, we thought we'd try something new. And I have to say, this is because the doctors that I work with were game to try it. We tried to connect the dots, and I've heard that phrase used several times today. Here's what we did. We took tablets and we send them home with our patients. Our doctors make virtual house calls. Our first trial was 8 patients and 35 appointments. We didn't know if the technology would work, and we didn't know how patients would feel about it or their families. Some of the results we thought would happen, and some of the results were surprising. And that's really what's interesting and what I want to talk to you about. Patients and families feel well supported at home using the technology. Doctors can check in more often, and their symptoms are managed. Families feel and report decreased stress and anxiety because they don't have to travel in all of the time and try and transport their family member into the clinic. Now, here's the interesting thing that we weren't expecting. Most of our patients are older, non-technical savvy is how they describe themselves. And so we wanted them to identify a support person, niece, nephew, son, daughter, someone who could help them with the technology. But after their first 1 or 2 appointments, many times they connect by themselves. Because they're by themselves, they have different conversations than they would have with their family members present. They seem to have an increased level of intimacy, and they ask more hard questions. They may say things like, "How much time do I have left?" And "Is it time for me to go to hospice now?" We don't want to burden those that we love, and so we don't necessarily have those conversations when we come into an outpatient clinic or when our family members are there. Because of these findings, I suspect that video appointments into the home may be better than in-person appointments. Not just meeting that bar of as good as, but actually exceeding it, especially for this type of patient. Patients are within the comfort of their own home. They're not distracted by strangers or the office environment. And they get to have more intimate conversations. They also don't have the dreaded white coat syndrome. Now, one of our doctors, he's over 6 feet tall, and he can be a pretty imposing figure. This was used with permission, by the way. But over video, look at him. He's just 7 inches wide. He might have a few words to say to me about this after. We are changing the experience for our patients. Even if we're able to get to that near 80%, there's always going to be patients and families that need to be with us. We've also used the technology when the patient has to be with us. So in one case, we connected a patient with an engagement party. The patient was with us in hospital, and the engagement party at home, they had the tablet, and the patient was on the tablet screen, welcoming family, friends, and neighbors as they enter the house. We've also used it to connect a patient to a wedding ceremony. They were present from the view of the altar and could hear and see everything that went on, and died shortly after. If we want 80% of the time to be home, using technology is part of the answer. And if we want to improve the quality of life for people, no matter where they are, technology is part of the answer. It enables better communication. How many times have you said things like, "I love you, I miss you, XOX," over text or email that you wouldn't necessarily say in person? Although maybe that's cultural, and maybe it's just because we're Canadian, I don't know. I challenge you to think about video technology as being better than in-person appointments. We're researching this question right now, and our patients are going to be able to speak through that research. I'll give you a couple of quotes from our patients and families. One said, "We felt like we were right there with the doctor." And another one said, "This should be available to every patient." One of the ladies that I work with, her name's Sue, I told her I was coming today, and when I told her about this work, she said, wow, this would have been fantastic when my dad was sick. My mom would stress for 3 days before bringing him in for every single appointment. Please continue the work and try and continue to make it happen. We're very blessed to be in this age of technology and where we can use it in ways to increase our quality of life for people. I wanted to end my talk today with a spiritual master or a philosopher, and I think I might have found one that's pretty good. The Lorax from Dr. Seuss says, unless you care a whole awful lot, it's not going to get better. It's not. And so when Sue told me about her mom, I thought, I have to start telling this story to everyone. So let's not be afraid of using technology in healthcare. And let's not be afraid of the words palliative care. Thank you.